Good morning, Mark, and welcome to the Low Carb Paleo Show.
Glad to be with you, Alain, and Mark. Good morning to both of you.
Good morning to you both as well. I hope you are both suitably well.
I didn't put my suit on, but I am suitably well. So, Mark in America, so to speak, your friend and colleague and podcast partner, John Bagnulo, which has been on the show already, suggested we talk to you, and thank you for coming on the show.
My pleasure.
A quick presentation. You are a board-certified internist, nephrologist, and integrative medicine physician. You're also the director of medical education, wellness, and population health at Berkshire Health System. You can tell from all the certificates on the wall behind you.
Yes.
So, talking about your background, how did you come to do what you're doing now, and what was your defining moment?
It's been an interesting journey, Alan. As you mentioned, my original training is in nephrology, kidney specialty, and kidney specialists tend to take care of really sick people that require dialysis because their kidneys are failing. And often they have many health issues, high blood pressure, diabetes, high cholesterol, heart disease, etc. And about 15 years ago, both my parents developed kidney failure. It was just a horrible coincidence. And I had an epiphany at that time in my life, Alan, that most of what my parents confronted, and there was a great deal of suffering involved, could have been prevented. And it set me on a journey of gaining a better understanding of nutrition and lifestyle, which led to more training in integrative medicine and has totally transformed the way I care for myself and the way that I serve others. Right.
So you still have one foot in the traditional Western style medicine, but you're also more of a sort of alternative medicine as well?
Exactly, Alan. And I do straddle those worlds. Much of my professional life is steeped in academic educational models that practice very traditional approaches to care, and the other half very much outside of that, focusing on lifestyle. But one of the things that I am seeing now, Alan, certainly in America, though the pace of change is slow, is that those worlds are coming together more and more. So there's much more convergence of the integrative with the traditional, and in population health, that's very relevant because ultimately it's all about helping people care for themselves in a more effective way.
Yeah. So, and you're the perfect person to do that because you are, steeped in traditional style of medicine. Do you integrate nutrition and all these quote unquote alternative ways into your traditional treatments, or do you recommend, or do you keep those two separate? Like you have, what you do in the hospital and what you do in your private practice.
They are very much overlapped and much more congruent now, Alan, and that continues to be the case with each passing month. So most of our community programs in diabetes and helping people lose weight are translations of the nutritional science and mind-body science. Things that would have been more peripheral a few years ago are now very central to all of that. So there's a great deal of overlap now.
So it's not considered as woo-woo kind of thing anymore.
Not as much, though I have to say, I've been in this health system, Berkshire Health Systems now for almost 30 years. So it does help to have some relationship capital. Other physicians look at me and have a kind of an understanding of where I've been and where I'm at. And it makes the sell, if you will, a bit easier.
Right. And the interesting, of course, what you and I know is most of what you're dealing with in your professional environment could be fairly easily controlled through diet and lifestyle changes, right?
Absolutely, Alan. And I think that's really where the rubber meets the road. We know that almost 80% of all chronic complex health issues are lifestyle related. And even if physicians have an interest in that, often they don't have much time to spend with people or the resources they need to help others in those domains of their lives. So this has never been more important than it is right now.
So typically in your daily practice, you tend to come towards the end of the problem when it's already maybe not too late, but so how do you combine the preventative part? Do you catch the clients or your patients before it's too late? Are you able to fix that or help them?
Really, the continuum varies from people who are at risk and have an enormous opportunity for preventing diseases in their future, to the other end of the continuum where I'll see people who have quite advanced chronic complex disease. But as I like to share with folks, no matter where somebody is on that continuum of their health, there are always tremendous opportunities. And for people who have more advanced disease, even if one is beyond the point of reversibility, there's a great deal one can do to manage how that disease is disrupting a person's life, and the opportunities are great there as well. So it's always nice when you can catch someone more upstream, but this is a model that can impact anyone no matter where they're at on that continuum.
Are you, do you have sometimes the luck to be able to reverse certain, through diet and so on?
It's an interesting question, Alan, because the R word in American medicine is not one that is used that often. And when your models of understanding and education are such that a disease, once it occurs, is just part of who you are, you're less likely to think of it in terms of reversibility. I think most of the research now is very clear that many health issues, particularly pre-diabetes, a person who is at risk of diabetes, and in America, that's almost 1 out of 3 adults. Wow. And people who have actual type 2 diabetes, there's a lot of interesting research to suggest that you can reverse those diseases.
Oh, absolutely.
I think we're going to learn that most chronic complex diseases have profound capacity for reversal, at least to some extent, no matter where a person is at in their experience of that disease process.
Yeah, case in point there is my dad. I mean, he's been diagnosed with diabetes for 10 or 15 years. And back in March, he had a stroke. And because of that, I've been looking after him. While he was in hospital, the dietitian said, you need to go on a low-carb diet, which was a shock to me. Wow. Obviously, I know a little bit about low-carb diets. So as he's living with me, I put him on a low-carb diet. So he's now off of insulin, and he's been off of his glycoside as well for about 4 months. And it's got to the point now where the doctors are saying, well, we don't think we need to monitor you for diabetes anymore. So it can be reversed.
It can be reversed, yeah. And that's been my experience, Mark, for countless numbers of people that I've worked with.
Yeah, I found it shameful that once you're into the medical system, they seem to assume that once you have a certain condition or sickness, that's it. That's the end. All we can do is do, pharmaceutical and surgery and this and that. That's typically the approach. My dad died of cancer, and one of my fights is to survive or to reverse the potential for cancer. That some people say, well, if your parent died of cancer, you're going to die of cancer, right? Well, with epigenetics now, we can confirm that you can control, to a certain extent, you can control the behavior of your cells. And if it doesn't mean because one of your parents died of cancer, then you're going to catch it. So I do believe very strongly in preventative, not just medicine, but, eating healthy, behavior, exercise, so on and so forth. And in this case, Mark's dad is a very good example. We can reverse certain conditions. It's not easy. And most of the time, unfortunately, when the patient comes to us, whether me as a nutritionist consultant, it's in a lot of cases too late, or it's your last resort. They come to you first. They come to the regular medicine, and if the regular medicine is, well, there's nothing we can do, then they come to me because somehow they think. And in a few cases, I've been able to help, but it's difficult to convince a patient to change their habits. It's very difficult. Have you seen that too?
I have absolutely seen that, Alain. You brought up something that really jumped out at me, and I think it's so fundamental. And one of the reasons that many people tend to resist the possibility of change is this field of epigenetics. I find that certainly many physicians in America still, and many people that we serve are under the impression that most of the health issues they confront are largely genetically driven. And the mindset is, these are cards that I inherited. There's not a whole lot I can do to change the cards that I'm holding. And fortunately, I have things that I can take in the form of pharmaceuticals. So I do think that this revolution of biology and our understanding that all aspects of lifestyle and the environments that we are in fundamentally shift throughout our lives is crucially important. And so a lot of what I try to do as a practitioner is to understand the perceptions that guide the behaviors of those that I serve, and to try to transform those behaviors. And consistently, one area of opportunity there is helping people realize that it's not genetically locked in, that one of the reasons their mother or father had it is because they confronted the same environmental conditions. They ate the same foods. They moved the same way. They had the same stressors in their lives. So what they inherited were not so much fixed genetic predeterminants. They inherited social and environmental conditions that set the stage. And people are capable of understanding that. And once I can help a person begin to appreciate how malleable we are as human beings, and how quickly they can begin to experience change in their lives, you begin to see that shift. And I think that's critical.
Right. One thing that we've known for a long time, I believe, is that our cells regenerate all the time. It makes sense that if we generate constantly new cells, why not make these new cells healthy cells, and guide them to be healthy? So I don't see, so far, knock on wood, I'm healthy, but I don't see that any lifestyle type of illnesses are definitive.
And I totally agree with that, Alain. And I can tell you, early on in my career, that was not my perception. And that's part of what the transformation for me as a caregiver has been. Part of that challenge as caregivers and as people who are looking to find a better way to care for themselves requires unlearning, transforming some of the perceptions that have guided them. And as we've been reflecting, I try to help. I think experience is the best teacher. So I try to help people create experiences in their lives that they can begin to notice in a relatively short time. They may change the way they're eating. They may change the way they're moving. They may change the way they are interpreting and responding to stressors in their lives. And I know, and I can share with them confidently, that in a relatively short time, their experience of life is going to begin to shift. And that, I find, is the most powerful lever to begin to nudge someone in the direction of changing the way they care for themselves.
Right. There's a couple of side issues that I'd like to address. One of them is that it seems that the system has brainwashed people into believing that the doctors, I could do whatever, the doctors will fix me. It's like they're giving up their control over their own health and giving it away to doctors and such. I completely disagree with that. We should be this is our body. We should be in charge of it, and we should control not only the way we handle it and the way we care for it, but also how we work with the doctors to get better.
I think they're giving up.
I'm sorry, go ahead.
I think they're giving up common sense as well, Alan.
Right. But it's also part of it is brainwashing, is in the sense that we are the doctors, and you know nothing, and we're going to tell you what to do. So give away all your power. We'll take care of you.
And the American healthcare system, Alan, is perfectly designed to produce the results that we currently see, which is some of the sickest human beings that have ever walked this planet. And so I couldn't agree more with what you say. There has been this tendency to believe that the doctor will fix me when I'm broken, and that there is nothing empowering or true in that ideology, and yet it's still quite pervasive. I do find there's a bit of a generational shift, certainly in the United States, where the younger generations are much less willing to relinquish the control they have over their lives. They're much more skeptical. They question more, and that gives me hope in terms of sort of moving beyond that mindset, which has been so pervasive.
Yes, another behavior that I notice, which is maybe not entirely medical, more psychological, is some people actually think their disease defines them. It's like they own their disease. They become their disease. That's all they talk about is their disease. I have a couple of friends like this. Every time we meet, it's like, oh, I have this, I have that, and I didn't, and it's always about their sickness. How do you explain that?
That's another great observation, and I see that all the time. People will tell me, I'm a diabetic, I'm a hypertensive, and it speaks to this critical issue of mindset. How are the interpretation and response to the experiences of our lives begin to define how we perceive ourselves. And so I think part of this revolution, if I could suggest it to be that, is a need to help people realize that they're human beings with infinite possibility, and the conditions that they confront in their lives are consequences of the relationship between who they are and the choices that they make, and that's a liberating, empowering position to take. But at the same time, Alain, there's a challenge there. A person is then forced to look into the mirror and say, "Wow, perhaps I'm not who I thought I was. And as a consequence, I need to assume more responsibility for the choices I make." That can be a very unsettling place for people to be, and yet it's profoundly empowering. But those are, you touched on what I believe to be cultural memes. I'm a disease. It's genetic. I can't do anything about it. The doctor and the hospitals are there to fix me. From a population health perspective, those are the worst ideologies to in any way promote or liberate the health potential that people have.
Yeah.
Right. But on the other side of the coin, do you find doctors, or maybe younger doctors, more willing to actually discuss and communicate with their clients, or involve their clients with the whole process?
I think there are more and more physicians that desire to have those conversations, Alain. At the same time, they confront a growing disconnect between the values that they embody and the model of care that they practice in, which gives them so little time to explore those issues. They're incentivized to see lots of people and to do lots of things. So what I see now is a growing crisis of value conflict between that which caregivers embody and that which they actually experience in the context of the work that they do. And it's very frustrating for them. So
Right.
I think more want to have those conversations. And there are some, even for those that maybe haven't learned a lot about nutrition, for example, rarely do I confront a colleague, and I love my colleagues. They're my brothers and sisters who aren't confronting some health issue in their own lives or confronting burnout. And so I try to help them look at their own lives as examples of opportunities for them to transform the way they think about care. And that can be another powerful lever to shift the way they think about how they engage those that they serve. It's challenging.
Yeah.
Right, absolutely. And regarding the pressure put on the doctors, let's be honest about it. In this country, at least, healthcare is a huge business, and it's a lot about money. It's not necessarily about taking care of people. There's a difference in Europe. I don't know about in England, but in France, there seems to be more of a taking care of the customer or taking care of the patient more than making money. And I don't know if it's a general, I think it's a general European way of looking at it. The system there is very socialized, so their advantage is to heal people faster and get them out of the system instead of dragging it out, making more money out of them. What's your take on that?
Well, I think the American healthcare system could learn a lot from what's happening in other countries and could learn a lot about what's happening in other industries that are much more sort of service oriented, if you will. We spent $3.6 trillion in the American healthcare system last year, and it's estimated that over a third of that is essentially squandered for things that do not prolong life or enhance the quality of life. And so when you look at the effect that the market has, 18, 19% of our gross domestic product, largely going to pharmaceuticals, largely going to biomedical interventions, it's the perfect design to create profit motive. And even well-intentioned people, it's very hard to achieve the outcome of empowerment when that is going to risk people taking fewer medicines, people requiring fewer surgeries and all the things that have generated profit are now in conflict with a system that can no longer afford to care for the people that it serves. So there are very pernicious conflicts at play that are powerful and influence how we govern in America, and probably true in other countries as well.
I hear that more and more doctors are quitting the traditional, so to speak, because it's not that, it's really the last couple of generations. Because in the old days, there was more of a sense of taking care of your family doctors. They would come and see you and so on and so forth. So there was more of a caring type of personality, but it's turned into a huge business. But I hear that more and more doctors are moving out of that and establishing, either they're moving into the more alternative, or they establish their own private business that would take better care and will give them, or they will take the time to actually talk to people instead of having 10 minutes, with the clipboard, looking at a clipboard, and then boom, they're gone. What's are you seeing this shift as well?
I'm definitely seeing that shift more and more with each passing year, Alain. And there are a couple of shifts that I see. One is in the category that you described, physicians that can no longer feel satisfied with their inability to serve in ways that they would like to serve. So they divorce themselves, if you will, from the more traditional insurance model here in America. And they focus on practices where they can spend more time with individuals, focus more on lifestyle, And there does tend to be more of a cash exchange as opposed to a third-party insurance exchange. And more physicians are doing that. And I totally understand that. The other trend that I see, Alain, is that I have a lot of colleagues that are expediting their decision to retire because they're on that part of their career where it's simply no longer worth it for them to be seeing 30 people a day, to be spending hours on the computer doing all of their electronic documentation, things that have nothing to do with the direct relationship or compassion of caring for others. So I'm seeing a lot of physicians choosing to retire at younger ages than they would have otherwise. And I think these have huge implications for workforce needs and for how future physicians look at their care. And that's the third thing that I see, Alain. I work a lot with young residents who are training. They've not yet gone into practice. Many of them don't want to go into primary care, family medicine, pediatrics, because they see how crazy that model is and how ineffective it can be. And they're choosing careers that tend to be more procedurally oriented. It feeds this model of doing things. And so I think there are issues for young doctors, for doctors that are in the prime of their practices that are finding another way to do what they do, and those on the tail end of their practices that are choosing to retire at a time in their lives when they have more wisdom than ever. And there's something sad and tragic about that.
Yeah. The problem I see with that is, I think it's a great thing for them to shift away from that. The problem is the system does not support that. It's all geared towards insurance paperwork and being reimbursed, whereby the one that try to get out of that system are forcing cash payment or credit cards or whatever, which kind of forced sort of like put away or pushes away the people that can't afford to pay cash.
Yes.
I mean, even in my situation, and I'm not that expensive, but a lot of people, when I tell them, it's $150 for the first consultation or first meeting, and they look at me, well, my insurance is not going to pay for that. So, sorry, I mean, I don't take insurance, and I lose customers that way. So I'm seeing that although it is a great shift, I also see the fact that people that can afford this kind of medicine will go more towards that and get more personalized medicine. And the rest of the people that can't afford that, they still be stuck in the traditional system of insurance and all the nightmares that goes with it.
Yes, that's a big issue, Alain. And there is a bit of a paradox. In America, for example, we know that, and this is true all over the world, but in America and where I serve, people with fewer resources, we know, are at much greater risk of chronic complex disease. When you look at the social determinants of health, your health literacy, how educated you are, how your financial resources, your social networks of loving friends, people in those lower socioeconomic strata have much worse health outcomes, a much higher prevalence of substance use, and those folks are locked in to this system. There's no way they could see someone like yourself or many of my colleagues who do amazing work in a different model of care. So those that need it most are least likely to have access to it. And until we gut our system and rebuild it from the ground up, I think that's going to continue to be an enormous paradox.
Yeah, I think you and I will be long gone before that happens, unless there's some kind of revolution that happens, or complete, what I hear also, and on one hand, it's a great shift, but it also brings us back to the same problem, which is doctors are so sick and tired of filling paperwork all day long they decide to go into a system that is more personal. You pay a certain fee per month, and you have complete access to your doctor, literally 24 hours a day.
Yes.
And it's more personalized. They actually come to your house. They do home visits and so on and so forth. It's very intriguing, but again, it tends to target the richer population because they can afford to do that. But on the other hand, if you look at Obamacare or ACA, you see that people are paying higher and higher premiums every year. I mean, my premium has been going up every year, and to get what? So in a way, I would say I'd rather pay directly a doctor to take care of me more personally than paying into the system that most likely, if I have a grave disease, will say, well, sorry, we don't cover that, or it's not part of your plan, or whatever. So this whole system is really not, to me, again, I'm coming from a different point of view from France, is not very efficient. It's and it certainly doesn't seem to take good care of the patients or the people.
Well, I couldn't agree with you more. And the model you describe is a model that I would desire as a someone in need of care. And I think Americans certainly have higher deductibles. They have more co-pays. So much of those costs are being shifted to the consumer, and what consumers need are more cost-efficient ways to care for themselves. Because, as we all know, as I'm sure the listeners of your podcast know, healthy living doesn't happen in doctors' offices, right? Healthy living doesn't happen in hospitals. Healthy living and the road to healthy living is paved by the choices we make, how we eat and how we move and how we love. And there are inexpensive ways to do that, but this model just can't get us there.
Right. I'm going to share a typical experience. When I try to put my clients on a healthy diet, and the first, almost every time, not all the time, but the first reaction, healthy food is so expensive. And I say, wait a minute. Wouldn't you rather spend a little bit more money for food that is going to keep you healthy and taste great, right? Instead of paying lots of money to doctors, hospitals, and medicines later on. I mean, the choice is pretty clear to me. I'd rather stay healthy and eat good, tasty food than to get sick and miserable and having to pay all these thousands of dollars to the system.
Great. And I hear that all the time, Alain. I think there's a tendency for people to be most concerned about the short term. What is it going to cost me today or tomorrow or this week or this month? Rarely are they looking at this in terms of their lifespan, their health span. It's so much less expensive to pay a little bit more for the food that you eat than for all the co-pays and the emergency room visits and the medications. I think that's intuitive, but people are so locked into short-term thinking I find that always an intuitive case to make.
Right. The truth is people take better care of their cars than they take care of themselves.
Yeah, right. Go figure.
Right? Yeah. Oil change every 3 months or 3,000 miles and, regular maintenance and
yes.
And yet, so maybe we should design some kind of a plan, a similar plan, and say, okay, every 3 months you have to go to the doctor and get a checkup, or every year you need to do a complete physical, and make it mandatory, so to speak. Although the oil change is not mandatory, but it's so it's so ingrained into this is the way they get you to come back to the oil change all the time, but it's like, oh, you have to do it every 2,000 miles, otherwise your car is going to break down. Well, if we use the same analogy to clients and say, well, if you don't come and do a quick checkup every 3 months, your body is going to break down. So, right?
Indeed.
All right.
Totally
So moving along, you're the author of 2 books: The Savvy Patient, The the ultimate advocate for quality healthcare, and it's all in your head. Change your mind, change your health. What can you tell us about your books?
The Savvy Patient I wrote in, I believe it was 2004, Alan, and it's really a resource book intended to help consumers, people, to have a better understanding of the healthcare system and how it works, and how through that understanding they can develop ways of navigating more easily and with less conflict and less energy. So there are an array of topics, from how to prepare for an office visit, what kind of questions might you want to consider in advance of a visit, what alternatives might there be to a trip to the emergency department, how do you support a loved one who's in the hospital, how do you think about your advance directives, as we refer to them in the United States? That might be a living will. It might be a healthcare proxy. How do you talk about death? How do you think about your mortality in a way that can perhaps reduce the suffering that someone might otherwise have at the end of their lives? So it's an array of topics. It's more of a resource book. And I share a lot of my own personal experiences as I was a caregiver for my parents, in an effort to connect in a way that's both personal and professional with the reader. The second book, the It's All in Your Head, I wrote a few years later, very interested in this burgeoning area of the neurosciences and neuroplasticity and behaviors, sort of the biology of behavior, and how people could begin to think about simple strategies in their lives that could ignite a neurobiologic pattern that could make more likely the next choice will serve them better than the previous one. And so it's an attempt to extrapolate the neurosciences in a day-to-day pragmatic way to give people more traction in their lives.
You know what? I think I'm gonna offer to exchange one of my books with the Savvy Patient. That sounds really interesting.
Great.
I'm making notes right now. So very interesting. Definitely gonna ask you that. So now I have a tricky question for you. What diet are you following?
So, as coincidence would have it, currently I'm on a low-carb paleo lifestyle and have been on that for a few years now, Alan. The footnote I would add to the paleo is I do occasionally have dairy. That comes in the form of heavy cream or whipping cream that I will occasionally put in a cup of coffee. I might on occasion have a legume or a black bean, but for the most part, I've been low-carb paleo, and it's totally changed my life. And many of the genetics that I inherited from my parents, right, to the original point that you made, epigenetically, I have reprogrammed my cell biology. And so that I've experienced that, and this is a plan that has worked really well for me, and I often recommend it to others.
I'm on a similar kind of plan. It's more of a primal. I love cheese. I'm French. I can't help it, right? It's in my blood. So I do eat cheese once in a while. It's not like I have it in my refrigerator. It's if I go to a social event, then I'll eat the whole cheese tray just by myself. And as far as legumes, I found that once in a while I need to eat some lentils to help my digestive system, if you know what I mean. Yes. I would say that I'm typically 90% paleo at this point, or primal.
Yes.
So what made you decide to switch to this diet?
Well, I had tried various things. I was vegetarian in the past for some time, and I certainly did the low-fat Ornish type program for some time, and I've been a very assertive biohacker. I have tracked my labs along the way. I'm very mindful of how I feel at any given time, and really hit a low point back when I was vegetarian, And as I started to bring in another iteration of changing lifestyle, when I began to look at paleo, look at a lot of the research that I was very interested in, it was very intuitive, very rational. The research was abundant. And as I began to make that shift, I experienced immediate change. And, you know, the more you do, the more you do when you're feeling better as a consequence. So,
right.
And so I've been there for some time.
Right, right. And we're not, today we'll be nice. We won't say bad things about vegans.
No. No. We'll not do that.
So, and I don't know how you do all these things, writing books and keeping a busy practice. And on top of that, you have a podcast, The Health Edge. The Health Edge.
Yes.
Excuse my French accent. With your partner, John Bagnulo. What do you talk about on your show? Is it kind of all over the place, or do you specific targeted towards certain subjects?
The Health Edge has been a great collaborative with my colleague, as you know, John Bagnulo, who's a nutritional scientist, also has a master's in public health, an extraordinary human being. We really focus on an ancestral lens. We look at health from the perspective of ancestral alignment. And John and I are both cell biology geeks, so we focus on a wide array of topics. We take a deep dive. We try to stay true to the rigor of the research that's out there, but you know, we also adapt to the science as it adapts. And so it's really a deep dive, a translation, if you will, of the research that's out there that can help give people more traction in their lives. It's a lot of fun, and I have found, compared to writing books, that podcast can allow you to reach a large number of people in a very effective way with a little less energy consumption that writing a book has. So it's been a nice platform for us.
It does take time to write a book, that's for sure. You recently went to speak at the 2018 Physicians for Ancestral Health Conference in San Diego. What was your talk about?
So my talk was on the relationship between epigenetics, lifestyle, and population health. All of the things that we've been sharing in this discussion, Alain.
Right.
And nothing like being around a group of like-minded professionals, all of whom have had remarkable personal journeys, and all of whom are continuing to explore ways to translate those journeys into the work that they do. Amazing work. Across many disciplines and in many different clinical settings. So it was a fabulous conference and a good tribe to be a member of. So
you're finding that physicians are starting to pay attention to diet as and lifestyle, obviously, more and more than they used to?
I think so. I think there's an acceleration of interest as the science explodes. I think as more caregivers find themselves inherently frustrated with their inability to transform the health of others, looking for other ways, I think this is really catching on and exploding.
Right. I can see where there will be much more of a emotional and spiritual satisfaction out of helping people get better, instead of just prescribing pills and, and cutting it to people.
No question.
Right. And I guess this is what's driving maybe younger doctors?
Yes, I'm seeing more of that for sure.
Mm. And you see also older doctors doing the same thing, or they're still more very much anchored into the old system?
I do see more older physicians shifting paths. I think it is inherently more challenging beyond a certain point in your career to kind of redefine the paradigm within which you see yourself and serve others. It's happening, but I think it can be a little more challenging when you've been locked in for so long. But it's happening across the age continuum.
Mm-hmm. I'm going to tease you a little bit. Have you noticed that, not everywhere, but it's been my observation that when you go to an hospital, you typically see the most unhealthy looking people working in hospitals, whether it's doctors or nurses or people behind the counter. Is it just my observation or?
And I think there's some truth to that. I can tell you, and I'm very familiar with the health metrics of our workforce, which is a large workforce, is a pretty clear reflection of what you see in the general public, and in some instances even worse, a lot of which is probably stress related. These are stressful cultures to be working in. So a lot of the work that I do is to care for the caregiver. And again, I think it's an important avenue to be inspiring changes in the way that not only how they serve themselves, but how they serve others. It's a huge challenge. I think it's also a huge opportunity.
Right. Well, thank you for doing that. Okay, yes. Mark M., it's your turn.
Well, before I forget, Mark, where can people find out more information about, all the things you've been talking about today and about you as a doctor, as a person?
Our website is the healthedgepodcast.com. The Health Edge Podcast, all one word, .com. Our podcast can be listened to, downloaded there. We have a wealth of information. Certainly, our podcast is available on iTunes and other outlets, and that would be the one-stop place to get a lot of hopefully useful and value-add information.
Excellent. I want to take you back a little bit. I mean, you said that you've been following a low-carb and more or less paleo diet for a number of years. What have you found have been sort of the most striking results of following that type of diet?
That's a great question, and there are so many. While I was not trying to lose weight, I noticed a big difference in my body composition. When I began to add that nutritional program with more resistance and aerobic activity, I saw a significant shift, decreasing my body fat stores, increasing my lean body mass. And at the age of 60, soon to be 61, that is a critical direction to be moving in. I saw dramatic changes in many of my biomarkers, all of my lipid measures, drops in triglycerides, increases in my HDL, lowering of sugar and insulin levels, lowering of hemoglobin A1C, a biomarker of glycation. And for the men out there, over the last 10 years, I have seen a dramatic increase in my testosterone levels, which I am convinced, while there are many attributes, largely a consequence of eating more healthy fat sources, dropping unhealthy carbs from my life, and managing stress more effectively. Those have been profound. I've never felt better. And while one never knows what the next day will bring, I've noticed profound changes, and it's been inspiring.
Excellent.
Is that why they call it functional medicine? Because you're very functional?
Exactly.
Maybe it's because you function better. One of the two.
What a novel concept.
Yeah, well, it could be. We could investigate that a bit more. Anyway, back to the script. So you've obviously seen some profound physical benefits. What about mental benefits and emotional health as well? Has that been affected at all by your diet?
It has as well. I would say that I get less fatigue during the day. I seem to have more energy, fewer peaks and troughs. Cognitively, and I work in an environment where you really have to stay sharp. I do find that I tend to be a little more creative, a little more innovative when I need to be, a little less frustrated, while others are maybe banging their heads against the wall. And I do find that I have more emotional resilience. It's a very stressful environment. Things tend to roll off me. I take myself much less seriously as I once did. I have a lot more fun. All those aspects of my life have been dramatically improved.
Excellent. Well, I know people are going to want something to take away today. So what would you say would be the 3 most effective things that someone can do in order to promote a better health for themselves?
Yeah, and in the few minutes I have remaining, as I have another meeting to run to, gentlemen, I would say certainly number 1, people have to start by loving themselves. I think self-love, self-compassion is an essential place to start in any journey of enlightenment and exploration. From a nutritional perspective, without question, cutting the poor quality carbohydrates and embracing fats that historically we have thought to be unhealthy, I think I could not imagine a more profound nutritional intervention for anyone than to look at a low-carb paleo lifestyle. And then I would say the third thing is to not to take oneself too seriously. I think we have to embrace life, enjoy life, see the humor in life, and just keep moving from one moment to the next.
Super. Well, thank you, Alain. And in view of the fact that you have to rush off, Alan, I think we better go straight to the close.
Here we go. Thank you again, Mark, for being on the Low Carb Paleo Show. And as we say in Texas, à votre santé, y'all.
Thank you both. Great pleasure.
No, it's
Thank
been
you
lovely
for your
having
time.
you, Mark.
Yeah, it's been great. Thank you very much.